Welcome to our practice session on CPT coding examples. Today we will dive into real life scenarios to sharpen our coding skills. Welcome back to my YouTube channel. If you are new to my channel, welcome to MedCode Insight. Hi, I am Nishaba, a certified medical coder. In the previous video, we discussed about the procedural codes of spine and spinal cord, upper and lower abdomen, and perineum. In this video, we will dive deeper by doing some practical questions related to these regions. So without further delay, let's get started. Our first question is, a patient having multiple injuries including a ruptured spleen. He is taken to surgery for an emergency splenectomy. Quote the anesthesia services. Option A 00790, option B 00840 along with add-on code 99140. Option C 00800, option D 00790 along with add-on code 99140. First, we will eliminate the option on the basis of qualifying circumstance add-on code. As the surgery was done in emergency condition, so we will apply the qualifying circumstance add-on code 99140, which is for the emergency condition. So on the basis of this rule, we will eliminate the option A and C. After eliminating option A and C on the basis of qualifying circumstance add-on code, our next step is to find the correct service code. The first code is 00790, anesthesia for intraperitoneal procedure in upper abdomen including laparoscopy, not otherwise specified. Our next code is 00800, anesthesia for procedure on lower anterior abdominal wall, not otherwise specified. Next code is 00840, anesthesia for intraperitoneal procedure in lower abdomen including laparoscopy, not otherwise specified. In this scenario, the service was done on spleen, which is the part of upper abdominal quadrant. So on this basis, we will eliminate the options with the service code 00800 and 00840. Our correct service code is 00790. Our correct option is option D with service code 99790 along with qualifying circumstance add-on code 99140. Our next question is, select the correct anesthesia code for a patient underwent ESWL for renal calculus. Option A 00873, option B 00872, option C 00870, option D 00860. We will eliminate the option on the basis of service code. The first code is 00860, anesthesia for extraperitoneal procedure in lower abdomen including urinary tract, not otherwise specified. Our next code is 00870, anesthesia for extraperitoneal procedure in lower abdomen including urinary tract, cystolithotomy. Our next code is 00872, anesthesia for lithotripsy, extracorporeal shock wave with water bath. Next code is 00873, anesthesia for lithotripsy, extracorporeal shock wave without water bath. In this scenario, the service performed was ESWL, which means extracorporeal shock wave lithotripsy, and it is without water bath. So our correct service code is 00873, anesthesia for lithotripsy, extracorporeal shock wave without water bath. Our correct option is option A with service code 00873. Our next question is, a 7-year-old with an inguinal hernia present for hernia repair. The anesthesia is administered by a medically directed CRNA. The anesthesiologist medically directing this case in addition to two other concurrent cases. Report for the anesthesia service. Option A 00830 along with modified AA. Option B 00830 along with modifier AD. Option C 00830 along with modifier QK. Option D 00830 along with modifier QS. We will find the correct option on the basis of correct HCPCS modifier. The service code given in all four options is 00830, which is anesthesia for hernia repair in the lower abdomen, not otherwise specified. The first modifier is AA, anesthesia service performed personally by the anesthesiologist. Next modifier is AD, which represent medical supervision by a physician more than four concurrent anesthesia procedures. Next modifier is QK, which is for the medical direction of two, three, or four concurrent anesthesia procedures involving qualified individual. Next modifier is QX, which is for monitor anesthesia care service. In this scenario, the anesthesia service is medically directed by anesthesiologist, which directing this case in addition to two other concurrent cases, which correctly matches with our modifier QK. So our correct HCPCS modifier is QK, which is for the medical direction of two, three, or four concurrent anesthesia procedure involving qualified individuals. So our correct option is option C with service code 00830 along with modifier QK. Our next question is it possible to have more than one qualifying circumstances for an anesthesia code? What qualifying circumstance code should be added onto the procedure code for lower abdominal hernia repair in the child younger than 1 year of age who became significantly hypotensive during the procedure, causing an emergency condition? Option A 00834 along with add-on code 99100 and 99135. Option B 00834 along with add-on code 99100 and 99140. Option C 00834 along with add-on code 99140 and 99135. Option D 00834 along with add-on code 99140. We will eliminate the option on the basis of correct qualifying circumstance add-on code. The first add-on code is 99100, anesthesia for patient of extreme age, younger than 1 year and older than 70 years. In this scenario, the age of the child is younger than 1 year and the service given is 00834, which is among the four combo codes along which we cannot use the qualified circumstance add-on code 99100. So on the basis of this rule, we will first eliminate the option A and B. The next qualifying circumstance add-on code is 99135, anesthesia complicated by utilization of controlled hypotension. Next qualifying circumstance add-on code is 99140, anesthesia complicated by emergency condition. According to anesthesia guideline, when multiple surgical procedures are performed during a single anesthesia administration, the anesthesia code representing the most complex procedure is reported. On the basis of this rule, we will use the service code along with the qualifying circumstance add-on code which represent the most complex procedure, which is 99140. So on the basis of this rule, we will also eliminate the option C. Our correct option is option D, along with service code 00834 and qualifying circumstance add-on code 99140. If you have any question or need further clarification, feel free to ask in the comment section or reach out via email. Thank you for watching. If you enjoyed the video, please like, share it. Your support means a lot to me. If you haven't already, consider subscribing for more. Click the bell icon to receive notifications. For more detailed guidelines, CPC mock exam related questions and notes, email me at my given email ID.